When doffing your PPE or removing safely, there is also a sequence you need to follow. Generally, this sequence will be gloves first, followed by hand hygiene, eyewear, gown, and then mask last, followed again by hand hygiene. It's important to remember that the outside and sleeves of the gown, the outside of the gloves, the front of the eye protection and the front of the respirator or mask are considered contaminated, even if they're not visibly soiled. The first item you're going to remove are your gloves. Grasping the wrist on the opposite side, fold in and remove. This is done on the other side as well. Discard appropriately. After removing your gloves, it's really important that you do hand hygiene. This method of removing is considered best practice. Once you've performed hand hygiene, you then remove your eyewear. Remember, avoid touching the front of your eyewear. You need to grasp from the sides. The next item you're going to remove is your gown. Grasping from the front up near the shoulders, break the neck, undo the tie or break the ties at the back, and fold the gown in on itself so that the front or contaminated area is all rolled up in a ball, and discard appropriately. The last item that we're going to remove is our face mask. You can do this a couple of different ways. You can either undo the ties at the back of the neck and the back of the head. In some cases, you'll be able to tear the ties at the corner of the mask. Remember, you want to avoid touching the front of the mask, as again, it's considered contaminated. Remove the mask and once again, dispose of in a bin. At the end of your removal sequence, you need to again perform hand hygiene.